of the Presidential Task Force, Honorable Ministers of Health, Honorable Ministers, gentlemen and ladies of the press. Obviously, I normally only refer to the Honorable Minister of Health, but this is a slightly different scenario for me, so bear with me. I will return this week to trying to address specific areas of the response every day, so to inform you and educate the public on the work that we're doing in various aspects. And today I'd like to focus a little bit on data and why it is so important to drive our response with data and the responsibility we have in collecting data and using it for every aspect of the response. Data is critical, from our surveillance to our lab, for our logistics, supply chain, for risk communication, for rumors, and I'll try and explain. After the Ebola outbreak in 2014-15, one of the biggest lessons that we learned was that we needed to collect electronic information on infectious diseases in Nigeria. At that time, information was collected on paper forms, translated into Excel sheets, and merged somehow at the state and at the federal level. So we started a gradual process of developing a new tool we called SORMAS. It's called the Surveillance Outbreak Response and Management and Analysis System, SORMAS, that we have used to collect data from health facilities up to the local government, to the states, and to the national. At the time COVID-19 started, through various interventions, scratching around for funds from here and there, we had managed to implement and deploy this tool to 22 of our 37 states. Since the beginning of the outbreak, we have worked very hard with partners, with the UN, especially with the European Union, who has specifically supported this project, and our colleagues in a university in Germany to continue deploying this tool. This tool is now the reason every night you see updated data from all the states in Nigeria on the number of new cases, number of suspect cases, number of lab tests. You know, it would have been impossible to do this level of analysis with paper and Excel. So within the outbreak, we have continued to improve the deployment of this tool, and we will now use it to continue analyzing the information we have in order to make decisions. We can tell you of all the cases, who their contacts are, how they are linked, as much as we know, and really use this on a day-to-day basis to make public health decisions. The other data tool that we have deployed recently is a data tool for logistics and supply chain management. So for the first time in any response, we can tell our leaders in the PTF, in the ministry, where every single mask that we have distributed in Nigeria has gone to, from where it has come from to where it has gone to. So when there was a lot of uproar in the social media about the Jack Ma donations, you know, which in effect was actually a very small part of the total donations that have come into our distribution and supply chain, I was very confident to tell everyone that we can not only give details for where every single mask, every gown, every boot has gone to, every single bottle of sanitizer that we have distributed in Nigeria, we can tell you exactly who has received it, what date he received it, the time, and who signed off on it. The third example I want to give is on risk communication. We have a fairly new platform which we call an event-based surveillance platform. It's called Tatafo, with which we use to manage and monitor rumors in the country. We use this to look around social media where new rumors are emerging in order to respond to those rumors. Because our responsibility, like the Honorable Minister of Information will always say, is managing two outbreaks. One real outbreak and one outbreak of misinformation that goes out every day. So we know when there's an emerging rumor on a fake cure somewhere across the country. We then develop a targeted response to that specific rumor and make sure that we inform Nigerians that this is not true, this is the alternative, and this is the reality. So we understand that our responsibility is not only managing the current outbreak, but also managing the misinformation around the country. The other thing, in the beginning of the outbreak, we implemented a tool to manage and monitor all returning travelers in Nigeria. So once they came into the airport, our 5 major international airports, of which only 4 were functional, of course they were then distributed around the country. So we could tell every state in Nigeria, Kwara State, you received 50 travelers returning from 1, 2, 3, 4 countries. These are their names, these are their contact addresses. Please follow up on them every day. So each of these travelers were followed up for 14 days on return. Not by us at NCDC, but people in the states where these people had gone to. All this would not have been possible without our data systems. And finally, what are we now doing? We're working with a group of modelers from around the country, coordinated by University College London, where a colleague, a Nigerian, is coordinating all the modeling groups, bringing them together, using our own data to now try and project with us where the epidemic is growing, where it's going to go, not only with our case data, but with other variables that we collect from other sources of data across the country. Using data to make informed decisions every day on where to invest resources, where to implement and accelerate the response. Without these tools, we will not be able to make the critical decisions that we're making. So in conclusion, as we manage this outbreak, data management is very important. There have been a bit of criticism in various aspects of our ability to manage data for several other parts of the response. The critical thing is not where we are today, it's how we can use whatever deficiencies we have to keep improving the system every day so that we can build our response and we can continue to guide the actions we take. This is a new virus. It means that the data points that we're trying to collect are not always very clear, so we keep improving, and every day we learn from our mistakes, and we hope to have an evidence-based scientific approach to the response in order to guide our actions now and in the future. So data remains at the heart of the response, and this, obviously, like we've always said, is a marathon, not a sprint. We'll keep improving as we move forward, and we hope that with time, we'll be able to share with Nigerians through various publications, through peer review and non-peer review papers, on how the response has evolved, how we have learned, and how we have used what we have learned to improve the response. Thank you.